Frontline workers in KwaZulu-Natal say they are overworked as they battle COVID-19 in full hospitals. Unions say doctors and nurses are increasingly testing positive for the coronavirus. Many have had to isolate, leaving those left behind with double the workload. The rising death rate amongst medical personnel is cause for concern.
We have received numerous reports from our members on the ground that quite a significant number of workers have passed on in the past few days. If you check at Edendale Hospital, we've received a report that more than 10 workers, majority of them are indeed nurses, have passed on. When you go to Mseleni Hospital in the northern part of KZN, we find that about 7 workers have passed on. Also, majority of them are nurses. When you come here in Durban, you find that more than 7 workers have passed on at Prince Mshieni. When you go to the side of Midlands, you find that at Ladysmith Hospital, more than 8 workers have passed on. We're extremely concerned as to how
unions say there should have been more support from government, especially during this second wave.
Since March, when all those who are either on isolation or quarantine through COVID are at home, there seems to be no plan of correcting or of ensuring that there is enough staff. Now that with the second wave, a lot of healthcare workers are dying. The situation is dire because those who are remaining behind, they don't get support from the employer and they are expected to ensure that there's continuity of service.
Doctors claim their complaints about staff shortages are falling on deaf ears.
We have been telling Department of Health there's a shortage of healthcare workers. It's not last year, it's not previous year. Last 30 years, there's a shortage of healthcare workers, nurses and doctors. Doctors-patient ratios are very high. We are not practicing quality medical services because public sector was inundated with HIV/AIDS diseases, chronic diseases, TB. We're supposed to have a more clinics, healthcare facility near the door to the patient where we cannot travel far. Clinics are run by a nursing staff. They don't have a staff there as well. We don't have a 24-hour clinics running in the community. So it affecting so much. The doctors are burned out. Nurses are burned out. They go home and come back. They don't have a rest. They don't have a time to eat sometime because 30-40% nurses and doctors are getting COVID-19 infection. So one nurse get infected, maybe the other one also going to get because they are working close environment.
More than 11,000 healthcare workers have been infected with COVID-19 in the public sector alone since the beginning of the pandemic. 107 succumbed to the disease. However, unions fear these numbers could be much higher. SABC News, Durban.